Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. So, we are so glad to be back in the hospitals. So glad to be able to support our clients in person again at the hospital. So, I just want to start my Tuesday with that. This week, I want to talk about hip pain during pregnancy. And there's a lot of different things that are happening, and I want to give you some examples, some tips and tricks, and also some resources that you can utilize with that sassy old hip pain. So, why do we have hip pain? Well, there's a lot happening, and your pelvis is really holding a lot of weight. And so, a lot of the times, what's happening is there's round ligament pain happening. Also, there's this hormone called relaxin, and relaxin is what kind of makes us very Gumby like. Towards the end of pregnancy, if you've ever seen or yourself have self-admitted to the pregnancy waddle, it makes you kind of hyper flexible in a sense. So always be careful and not overdoing it. Now, some people also have something that's called pubic symphysis disorder. And what that is like a separation of the front of the pelvis. So if you've ever gotten out of the car, I'm going to use this example, but you get out of the car and you're like one leg out and then you're like, oh, ouch. When you're sitting in your car, you should always turn and then exit the car when you're pregnant, just because when you hyperextend that pelvis like that, it can cause a very sharp pain. Now, what do you do with hip pain? Like, how do you get it to maybe stop, go away? What you want to look up, if you're using YouTube, look up like hip flexor stretches for pregnancy. You can also go to a chiropractor. Specifically, we love Webster Technique chiropractors. In order to find a Webster Technique certified chiropractor, you would go to icpa4kids.org. So icpa4kids.org. And you can do a zip code search and find a Webster certified chiropractor. And those are chiropractors that have taken extra training specifically on how to adjust pregnant women. And what I like to think about is the pelvis itself is kind of like a hot air balloon basket. And then the uterus is the balloon, and then all your muscles are the ropes. So if the basket is tilted and the ropes are off, the balloon's not going to fly very well. So that's always a nice thing to think about. Another resource is that you can look into a pelvic floor physical therapist. That usually can even come with a recommendation from your OB provider. Many hospitals have their own pelvic floor specialist, and they can really help you work on either strengthening or loosening your pelvic floor. Some people, especially like runners, bicyclists, they have a very, very tight pelvic floor, which sometimes can impede on pushing. Where other people might need to strengthen their pelvic floor. Also helps you just get a better understanding of what's going on below the waist. So those are kind of my tips and tricks, whether you have that pubic symphysis disorder or you have just like one hip is hurting more than the other. Those are some resources. Obviously, heating pad, you can use icing, absolutely. Epsom salt baths are always great to soak in and just relieve those joints and take the pressure off, take some of the weight off the load. But those are my tips and tricks for hip pain. Let me know if you have any others. That's our Tuesday Talks. I'll talk to you soon. Bye.